So there was a pivotal study on which I was a co-author. I represented ECOG, presented by Jeff Smiraj this morning, which in some ways was disappointing. But this was a study which was planned 5 or 6 years ago. And the whole idea is, could we use CTCs to guide frontline therapy in metastatic breast cancer? So the idea was to take patients de novo with metastatic breast cancer and look at their CTCs and see which ones had elevated CTCs, to see whether the chemotherapy altered the CTCs, and to modify your therapy based upon CTC change. So we took a set of women, and of those around, I think it was 43%, that had elevated CTCs over 5 at baseline. And so those were treated, so it's basically 1 in 2, effectively, just a little bit less than 1 in 2. So we then took those and treated them with whatever the chemotherapy was of choice. And then we took another 21-day sample and looked at those where the CTCs had gone down versus those where the CTCs had remained. So based upon Massimo Cristofanella's and others' work, one would expect that those who maintained a high level of CTCs would do badly, and so they were randomized to be switched between maintaining on their current therapy versus switching to a new therapy. So in other words, half the patients have elevated CTCs at baseline, treat them with chemo, look 21 days later, and if they've still got elevated CTCs, see if switching therapy makes any difference. So unfortunately, we ran the trial out, and it didn't make any difference. The hazard ratio, I think, was 1.01, so there's no difference. The one positive thing that came out of this was how dramatic the differences in prognosis were amongst those 3 groups. So if you look at those, and I've just got the figures here, if you look at those with low CTCs at baseline, and those that, so just basically none all the way through, they had an overall survival of 35 months and a progression-free survival on therapy of 11.1. If you look at those that had the elevated CTCs at the beginning and at 21 days, that was an especially bad risk group. So they had an overall survival of only 13 months, and they had a progression-free survival of 4.9 months. And those, of course, that had elevated CTCs at the beginning and then dropped it down at 21 days, their results were, of course, in the middle. So its OS is 13 months and the PFS is 4.9 months. So although the study was negative from the switching point of view, it does really show the importance of CTCs in terms of prognosis. And it also shows that following CTCs through their time course is going to be critically important. So this just gives us information on prognosis, which is, very useful, but we don't know what to do about it. And I think where everyone loves CTCs is the ability of what we call to do a liquid biopsy. So you can follow the CTCs. So all you need to do is just take some blood out and isolate them. You can follow these through sequential treatments at different time points. And then what our team wants to do is run molecular analyses on these to see what genes are changing in response to what therapies.